One thing the acting IRS chief did admit today, he doesn't want Obamacare for himself. Now, he is in charge of the agency helping to implement Obamacare, but I guess he doesn't want it. What do lawmakers think of that shocker? Ways and Means Committee member Congressman Peter Roskam joins us. Nice to see you, sir.
Thank you, Greta.
Were you surprised that the IRS acting chief doesn't want Obamacare? You prefer not to have it?
I was very surprised. I mean, here was Sam Johnson, congressman from Texas, who posed a very simple question. And why is it that the union representing the Treasury employees are trying to get out from under Obamacare? Why is it that they're afraid of this when they're given this task of implementing it? And the IRS commissioner was actually very frank, and he said, look, I like the coverage I have. I don't want to go into the exchange. That's exactly what he said. There's no other way to characterize it.
All right. Now, the coverage that he's not particularly fond of, the Obamacare, do members of Congress have Obamacare? Will they have it, and will their staff have it?
Members of Congress and their staff are in Obamacare.
They're
in the exchange.
Okay, so that at least they're taken care of.
Right.
Okay. All right. In terms of what did you want today from? Why was he testifying today?
Well, we had two people who were testifying. One is Mr. Cohen, who's in charge of the implementation at CMS, at Health and Human Services, and the other was Werfel, who we've heard from before, the acting director of the IRS. So in terms of CMS, look, they have a fraud rate of about 8% on Medicare payments, and the question that I posed to him is, you're blowing about $40 to $50 billion a year on Medicare fraud. What is it that you think you're doing so well on the IRS side as it relates to Obamacare? And he said there is absolutely no relationship between the two. In other words, it's, hey, look at the shiny object. Don't worry about our past conduct. Don't worry about the past fraud rate. Just let's concentrate on the future. It was an absurd assertion that doesn't stand any real scrutiny.
Well, it's funny you say that. I got a tweet from Airman Colfash, whoever he is, and he's obviously on Twitter following me. He says, if the government can't handle 900,000 cases of the vets, the backlog on the vets, how will they process 316 million with Obamacare? It's a complete disaster.
It's a complete disaster. They won't. The predictions are very dire. They haven't done the work, and at best, you know, they were sort of arguing in the alternative today. So at one point they said, well, the delay on the employer mandate is a very little thing. It's de minimis, basically. Well, if it's such a little thing, then why hasn't, you know, they've had 3 years to correct this and to get it all squared away. Why can't they make this right in 3 years?
What's the explanation for why the president, and I should say July 2nd too, he did it right before the 4th of July, but what is the explanation for why the administration is delaying the employer mandate?
They're not ready. They're completely overwhelmed. They can't figure out how to sync this up with the private sector. The private sector has come to the administration and said, you can't do this. Now, the thread and how this is all connected is if you've got no ability to know who's in and who's out in terms of employer coverage, then you don't know who gets the subsidies. And Paul Ryan posed a question, what happens if you give a subsidy to someone, then under the law you are compelled, the IRS is compelled to claw that back. So in other words, somebody innocently claims a benefit, and the IRS at some point in the future, under the law, has to claw that back.
Did you get all your questions answered by Werfel today?
No, not for a second.
I mean, was it that you didn't have enough time, or that he was dodging?
No, the time limitations are fairly strict. So you've got 5 minutes, and you've got to be very, very clear and highly coordinated with other members.
Did you walk away from the hearing today thinking that the acting chief thought, you know, we're totally on top of this, the IRS is ready to do this, there'll be no problem, there'll be no glitches?
No, there's no level of confidence that they were really communicating, and we have heard all these.
But did you think he had? I know that you're not confident, but did you think he was confident he was ready?
Well, they were putting a game face on. I'll give that for them. But the Congress has had these game face presentations from the administration in the past. So in other words, they have been asked these questions, or are you ready? And these very declarative assertions, Greta. Oh yeah, we're ready. It's game on, no problem. And this sort of dismissive subtext of how nice for you to be inquiring, but we've got it all under control. And then lo and behold, you learn the employer mandate's not ready. What else isn't ready?
Did they specifically say they're going to be ready for the employer mandate? Because obviously now they've admitted that they won't be.
No, they didn't. So in other words, they wanted to talk about other elements of Obamacare, but they were
But I mean, going past. I mean, was the fact on July 2nd when we learned that the employer mandate would be postponed a year? Were you surprised? Was that something different than the administration had been saying about the employer mandate?
Absolutely. And the other component is they were directly asked, you have information about these rates that have now been, you're discussing them with the carriers. Are these rates, can you guarantee that these rates are going to go down $2,500 a family? Crickets. No answer. No direct response. Well, you know, hedging and nonsense.
Congressman, thank you, sir.
Thanks, Greg.